Throughout the next hour, I'm going to be covering the following areas. First, we'll be providing you with a little bit of background regarding the organisations involved in the design and implementation of the Excellence in Care standard, and also to provide you with why we've developed the Excellence in Care framework. I'll provide you with an overview of the framework and the services that's available in order to support you throughout the process. I will review the assessment process with you, look at the costs, just give you an example. However, there will be initial questions, I'm sure, around the costs, so please come back to assessment services at a later stage to gain specific costs for your organisation. I'll look at the benefits of working with the Excellence in Care framework, and then potential next steps that you may like to take as an organisation. And once again, this will vary depending on what stage you're at as an organisation. So a little bit of background, you'll start to hear names such as Excellence Squared Limited and Assessment Services Limited. I think it's important that you understand where these sit within the framework. So in summary, Excellence Squared Limited is the custodian of many standards and frameworks. For example, leadership and management, the venue standard, customer focus, and the Excellence in Care framework. It is in the business of developing principles and measurements for organisations seeking ways to improve their performance, benchmark themselves, and gain recognition and celebration for their progress. We develop management tools that really challenge organisations that consistently aim for continuous improvement and want to be the best in class. A particular strength of Excellence Squared is its ability to tackle a very wide range of business challenges in many different locations across the world. And again, it's important to note that Excellence Squared works across the globe, providing many benchmarking opportunities, and defines, shapes and implements business strategies and provides practical advice and implementation to achieve organisations' outcomes. And the focus really is on helping organisations to deliver unrivaled and industry-leading customer experiences. In fact, it passionately believes that this should be weaved into the fabric of organisations. Its approach is pragmatic and collaborative, underpinned by specialist expertise in delivering measurable results to an organisation's bottom line. We use our insight and experience to provide substantial, sustained improvement in performance and deliver real, lasting return on investment. What's more, it offers independent, professional and practical business support services and has an established network of experienced specialist business advisors who work throughout the country and internationally, analysing organisations' requirements and ensuring they have access to best-in-class practices and ideas. It works across public, private and voluntary sectors with all sizes of organisations, providing expert advice on development and performance issues alongside a portfolio of diagnosis, benchmarking, performance review and assessment services. It is committed to providing a consistent, high-quality service that is flexible, innovative and responsive to customers' needs. Assessment Services Limited, formerly known as EMQC, has been in the business of administering standards and frameworks and providing a professional assessment service on behalf of awarding bodies and government departments. Assessment Services has been providing such a service for nearly 25 years now and has become known as the Boutique Assessment and Accreditation Centre. An assessment centre that has a very clear target market and takes time to understand and meet customer and stakeholder requirements. It delivers a bespoke customer experience and has a team of employees and 50 associate supply chain partners who, while acting as assessors for Assessment Services Limited, some also act as advisors and business development consultants on behalf of Excellence Squared. So they have a sense of community and belonging and are proud of what they deliver on behalf of these two businesses. And once again, these partners work across the UK and many work internationally. The aim of assessment services is summarised in its core values. We care, we assess, we add value. The assessors aim to provide a positive experience to any organisation being assessed and actively works with them to ensure the process is not burdensome or harrowing, which can often be the experience throughout other assessments and inspections. The aim is to catch you in, not out. As an international assessment company, Assessment Services works in partnership with government and other agencies to help deliver accreditation services for high quality, performance enhancing national standards, such as Matrix Standard, the Merlin Standard, and Customer Service Excellence. So all that being said, where did the Excellence in Care framework come from? Well, we listened to our customers and recognised the support required to enable directors, owner managers, senior leaders of such care establishments to continuously strive to meet and exceed stakeholder requirements and expectations in terms of the level of care provided. The care establishment has recognised the need to meet the Care Quality Commission requirements. However, many now view this as the minimum requirement to be achieved, which requires systems and processes to be implemented and owner managers, senior leaders, directors being totally committed to providing excellence in care. Many of these organisations are now seeking to raise the bar and be recognised for their efforts of themselves and those of their team in providing the highest standard of care to both service users and other stakeholders. It should be fair to say that some care establishments undertook and continue to undertake assessments against the Investors in People standard and Customer Service Excellence standard. And in some cases, these continue to add value and support continuous improvement. However, a frequently asked question was asked and continues to be asked in terms of what is next. And as a result, Excellence Squared recognised a gap in the market and started to undertake extensive research to establish best practice within care establishments, which involved gaining feedback from a range of stakeholders, including the organisations themselves, service users, families and friends of service users, employees and professionals, such as doctors, chiropodists, and even hairdressers, those that provide additional services. So consequently, the overall aim was to provide a national and international benchmarking tool that an establishment could use to start and sustain their journey to continuous improvement and both recognises and celebrates excellence in care. It should be noted that this framework is outcomes-based, and consequently, while strategies, systems and processes have to be in place, it is the impact that is measured through the use of Excellence in Care framework. Consequently, it is not sufficient to implement the systems and processes, but as a result, you should be continually evaluating the outcome of those systems and processes and the impact that it has on the business, and how this helps you to drive continuous improvement and move towards providing a high standard of service for all stakeholders. And that includes the service users, family, friends, visitors, professionals, including the doctors, nurses, dentists, chiropodists, etc. So the framework is divided into 5 elements, which I've listed there. I'm going to go through each of the elements in a little bit more detail, They are also then broken down into different criteria, which provides you an indication of what you're going to be measured against if you opt to use the framework. Whilst I'm going to give you an overview of the framework, I'm not going to go into each of the criteria in detail, but I would like to just give you an overview of the main aspects of what we'll be assessing you against. So, for example, in element 1, we're talking about the establishment. And it should be fair to say that before you embark upon a formal assessment against the Excellence in Care framework, the organisation should be meeting the minimum requirements of the CQC, Care Quality Commission, or equivalent in Scotland and Wales. A rating of good or, where possible, outstanding would be preferable, which demonstrates that you're meeting the minimum requirements of national standards. It's not fair to say that you can't work with the framework if you have achieved a lower rating throughout the CQC inspection. It's probably an opportunity for you to work with a framework, put systems, processes in place, measure and evaluate the impact in order to help you to raise the game and achieve the national standards required. So that's the first requirement for consideration. Is the organisation meeting the minimum requirements of national standards such as CQC and achieving good or outstanding in that area? It's important that an organisation really understands what excellence in care really means to the organisation. So a clear definition of excellence in care to your establishment would be required, which is displayed for all stakeholders to see. And that demonstrates to all stakeholders that you are actively committed to providing excellence in care and continually raising the bar. We'll be looking at how you plan and implement your strategies, systems and processes. But more importantly, your aims, objectives and key performance indicators that you have identified and then subsequently monitor progress and continuously improve performance as a result. So we'd have an in-depth look at your business planning, activity and outcomes in terms of the business plan and how this is used in order to facilitate continuous improvement. Whilst senior leaders and directors will be leading on this area, it is important that once again your staff, delivery staff and stakeholders clearly understand what your aims, objectives and key performance indicators are and regularly updated on performance. In addition, we'd be looking at the budget that you set and agree with managers in order to provide that standard of care, the resources that you require in order to deliver the care, which is very similar to that required of the CQC. But we're looking also at how you're continually monitoring and making changes to budget requirements in line with funding changes, issues that you're possibly facing, and also the changing needs of your service users and family and friends. We would look at the suppliers that you opt to work with and use and how you quality assure and monitor their performance and how they're adding value to your organisation. Is it value for money in terms of the service, the provision that they're providing? So in that instance, we would be looking at organisations providing you potentially with food, ensuring that you are monitoring their systems and processes for the food industry, as well as their pricing policy, right through to looking at your hairdresser chiropodist service and identifying, how do they add value to your establishment and how you are constantly improving the service that's being provided within the establishment. And finally, in this area of the establishment, we look at how you use information technology to support the provision of care. So many of you will already have facilities to update care plans, incident reporting, etc., using information technology. But we're looking a little bit wider afield and how you've embraced information technology and encourage your service users, family and friends to stay in touch by the use of information technology. So this may be through email, Skype conversations, FaceTime conversations. So how are you, ensuring that your service users are still in touch with the outside world? So in summary, those are sort of 8 criteria that would be assessing you against in element 1. In element 2, we're looking at people management, and in total there are 9 criteria. And we start by looking at how the roles, responsibilities and capabilities of leaders, managers and your delivery staff is identified, clearly defined and communicated. And then in turn, how are you ensuring that these people have the necessary training, development and achieve the qualifications in order to provide the excellence in care requirements. And this will range from legal and regulatory requirements through to providing specific service requirements to individual service users within the establishment. More importantly is then how you are measuring the impact of the learning and development that's being provided to employees. How do you know that it is cost effective and adding value to the organisation? What's been the impact as a result of providing these learning and development opportunities to your staff? We look at how you collect and evaluate feedback from all stakeholders, which will include service users, family, friends, professionals within the industry. And this is particularly looking at the effectiveness of the leadership and management of the organisation. So I'm sure on many occasions you'll be doing surveys, forums, which looks at the establishment and the service being provided, but this particularly looks at the leadership and management of the organisation. And having collected the feedback, then how is this feedback being used and how is it being acted upon in order to improve the leadership and management of the establishment? So we're expecting leaders and managers to be able to provide specific examples of feedback being provided in order to improve leadership and management within the organisation. We'd be looking at how leaders and managers deal with conflict and manage risk effectively to ensure a safe environment for all stakeholders. And how, probably the next one is very interesting in terms of how you recruit, looking at how you attract employees that have a genuine passion and commitment to providing a high standard of care. So on this occasion we'll be looking at how you recruit against the definition of excellence in care and the values of your organisation. How are you testing potential employees against the expectations that you set for staff within the establishment? And again, how are you measuring the impact and making improvements as a result in order to ensure you are employing the best in class into your organisation? In turn then, we look at the induction that you're providing to your new recruits and how you're really ensuring and reinforcing the excellence in care philosophy and working in line, behaving in line with the values of the organisation. So there's minimum expectations in order to meet external stakeholders, but for the excellence in care framework, we'll be looking at how you drive the excellence in care philosophy and how you're constantly benchmarking employees against that philosophy with the aim of improving their performance. So in turn, we're looking at the feedback that you're providing to employees throughout their employment with you. And many of you will already be doing supervision and an annual appraisal of some form, which is a minimum requirement. And what we're looking for is that throughout these conversations, how are you measuring the employees against the definition for excellence in care, against the values of your organisation? Do they clearly understand how they're valued and appreciated, the strengths that they're demonstrating? And also, do they have plans in place in order to improve their performance and contribute further to the standard of care being provided within the establishment? This doesn't happen without directors, leaders and managers being an inspiration to their people. So, senior leaders, managers need to be very clear about what it does mean to promote excellence in care, behave in line with the core values, and be demonstrating these on a day-to-day basis. Acting as role models in order for employees to recognise what's the minimum expectation within this establishment. So once again, throughout the assessment process, which I'll go through shortly, we'd be asking employees, are directors, leaders and managers truly role models when demonstrating a commitment to excellence in care and the values of your organisation? And finally, we'd look at the succession plan that you have in place. So, starting from the top, directors, leaders, managers, what's your succession plan? How are you identifying talent within your organisation, providing employees with appropriate information, advice and guidance on their future career prospects, and in turn then developing people in order to step up in the future? Or alternatively, what's your recruitment and selection plan in order to ensure you have the right people in the right place in order to ensure good succession planning and continuous promotion of excellence in care with the establishment? And as I've said previously, it is an outcomes-based standard. So again, we'll be looking at the impact this has on your establishment and how you're continuously improving your succession planning processes and outcomes. Element 3 is looking at people who use the services. So these will be predominantly your service users, but also it will be looking at the family, visitors, family, friends, professionals that visit the organisation. So what we're looking at is that every service user has a very clearly defined service, which should be in their plan, and recognises excellence in care within that process. The plan should be reviewed on a regular basis in consultation with the service user, family, on occasion probably friends, and those employees working very closely with the service user. So how do you embrace consultation and make sure that there is a good care plan in place that meets the full needs and possibly changing needs of that individual service user? We look at how you involve and engage service users and employees in creating a culture and environment which really does promote excellence in care and looks at every opportunity to be different and provide the best in class. So what actions are you taking in order to create that environment in which privacy, independence, dignity and respect really does form part of the culture of the establishment? We check out that both employees and service users, family and friends clearly understand what's expected and can confirm that they are truly given that choice, privacy, independence, dignity and respect throughout their care with the establishment. A key factor when we're working with service users is to be able to reflect upon their history, listen to their stories, and really promote memory recall. So another aspect that we look at in terms of people using the service is how you engage different stakeholders in developing a true understanding of your service users' history, and then the opportunities that you use, probably adopt, in order to encourage service users to share those stories. A number of you may have portraits, library murals on the walls, photographs to jog memories, but do you also consider different activities that you could promote in order to encourage service users to share their experiences? For example, coffee mornings, and an individual is invited to share a story. Which then leads on to how you actively promote participation and encourage service users to live a fulfilled, purposeful and enjoyable life whilst in your establishment. So how do you engage service users, family and friends in identifying appropriate activities or even events for service users to participate in? And then in turn, how do you facilitate the planning and implementation of those activities and identify different ways of encouraging participation of service users? And again, we're looking at how you're measuring the impact of these systems and processes. How can you demonstrate that you have good participation in such activities? And finally, and it is covered a little bit earlier, but to a certain extent, how do you gain feedback from your service users, employees, family, friends, in order to identify improvements to be made to the service, and in turn, what action have you taken as a result? Element 4 looks at stakeholder consultation. So what consultation strategies, systems and processes do you have in place in order to engage different stakeholders at different stages of a service user's stay within your establishment? So this will start from pre-admission. What consultation do you undertake at our admission stage and throughout the service user's stay? So we're looking at how you engage the service user and family friends in order to ensure you have a full picture and understanding of your service user and the care is aligned to their specific needs, and then ongoing reviews to ensure that changes in their circumstances are addressed. We'll look at how, as an establishment, you welcome and encourage other stakeholders to take an active part in the care of the service user. And this really starts right at the beginning in terms of how you engage them at pre-admission stage and admission stage. How do you ensure that a family member, friends truly understand that they are welcome? Are they able to make themselves tea, coffee? Where can they go with their family, with the service user? Do they know the do's and don'ts and who their main form of contact is? So a little bit of, what's the induction of a family friend member, so that they understand what's expected and how they're encouraged to visit the establishment. Also, of course, as I've mentioned previously, is how you encourage them in developing that life story regarding the service user. And finally, how do you communicate with external stakeholders? How do you ensure that family, friends, and other professionals know what's going on within the organisation and are invited to participate in certain activities? How are you measuring the impact of your communication strategies? Are they working well? Are you getting little response? How can these be improved going forward? So there's a little bit about communication and how you continually strive to engage all stakeholders in the delivery of the service from the establishment. And then finally, element 5, which is broken down into 5 criteria, which looks at the environment. And this looks at, initially, is the environment, both inside and outside, clean, well cared for, maintained on a regular basis? Whilst you'll have rotas in place, how are you measuring the impact, and is it adding value to the establishment? How do you engage your service users and other stakeholders in ensuring that you are looking at different aspects of the environment and making sure that you are the best? Whilst budgets are limited, it doesn't mean to say that a little bit of decorating couldn't help, or general maintenance in the garden, just to make an extra special appearance. We also look at your other standards that you would be working against. So, for example, 5-star environmental audits. We'd be looking at a minimum really of 4-star, 5-star ideally. But more importantly, as a result of undertaking such activities, assessments, inspections, what do you do as a result? How do you respond to the feedback? Work on your areas for improvement, but also maintain those strengths. Very often, we forget that whilst we've got areas for improvement, we do need to maintain the areas of strength that we've adopted within the establishment. What's your corporate and social responsibility strategy? How are you ensuring that staff needs are accommodated, that you're meeting the legal and regulatory requirements? So there's so many changes. We've had real-time collection of data via HMRC. We've now got the auto-enrollment pension process in place. So do you have a plan to make sure that you're meeting legal and regulatory staffing requirements, number of hours that staff are requiring? But then also, how are you contributing to the environment? How are you minimising the impact on regarding waste, and in some cases your carbon footprint? So again, we're looking at having targets, key performance indicators, and how you're measuring your commitment to corporate and social responsibility. And finally, how you are actively seeking ways to be involved in the local community. Are leaders and managers actively integrated within the local community, aware of what's going on within the community, and then in turn encourage service users to be part of that community? Have you made links with schools, with church choirs, in order to engage their services and provide activities, events to your service users? What activities have you done differently in order to increase the participation of service users within the establishment? Probably more importantly is how you've engaged them in identifying the different activities and involvement that they would endeavour and would like to see the organisation be part of within the local community. So that gives you a very quick overview of the framework. If you do require more in-depth detail, then the document is available for circulation. I will just advise that it is currently being rebranded to be representative of Excellence Squared and Assessment Services, but should be available shortly if you are interested in gaining more information. So in order to support you through achieving excellence in care, as I've said previously, you need to be fully compliant with the national standards, CQC, but then possibly consider undertaking a self-assessment analysis against the customer service framework. Review what your current position of the establishment is against each of the criteria, and consider what you believe you are doing well, how well you believe that's going, how successful it is in terms of the implementation, and most importantly, what is the impact on the provision of the service to your stakeholders, the impact to the service users, family, friend, employees and professionals. And what's your plans for improvement in order to sustain excellence in care and make sure that you've got the resources, budgets in order to continually improve the provision? You may opt to engage the services of a registered advisor, which could be through Excellence in Care. and they could literally take you through the framework and complete an initial gap analysis, diagnostic assessment, in order to identify what is currently in place and the impact it's having on the provision of the care, and identify potential gaps that may be needed to be addressed in order for you to undertake a full formative assessment. At the end of this process, you would be issued with an action plan indicating actions to be taken in order to meet the requirements of the framework. It possibly give you a timescale before you made any commitment to being assessed against the framework. Following any self-assessment analysis or diagnostic assessment, then you would be provided with a clear report which indicates the findings, what's working well, and what could be done to improve that aspect of the framework in future. So when we look at the assessment process, in the first instance, you are satisfied that you are meeting the minimum requirements of the national standards, and or opting to work with the framework in order to improve your current ratings. So this gives you a very quick overview of the assessment process that you would be working through. And I think it's important to state that you will be provided with advisors if requested, assessors, and they aim to work with you. As I've said previously, they're there to catch you in as opposed to catching you out. They're very interested in gaining the good things, what's working well, what is being successful and providing you with results. But equally, their job is to help you continuously improve. But they're not the police. They're not there wielding the truncheon and saying thou will do. They're there to make recommendations in order to support you improve performance. So let's look at the assessment process. So if you've decided that you would like to go through either a diagnostic or formative assessment, your first port of call would be to submit a booking form. And the booking form provides assessment services, the assessment body, with an overview of your organisation. It gives us an indication of the number of employees within the establishment providing the service and the number of service users, and a little bit about the care that you are providing to service users. For example, you may be an organisation that's purely set up to provide care for those suffering with Alzheimer's, in which case then we know that we would approach the assessment slightly differently, as gaining information from your service users would have to be done in a slightly different way. So the first instance, complete your booking form, providing us with as much detail as possible about your organisation, and possibly a little bit about why, what's the purpose, what's the objective of you undertaking the Excellence in Care Framework Assessment. At which stage then you will be allocated an Excellence in Care Assessor. Please note that this will be different. If you've had an advisor, your advisor will not be allocated as your assessor in order to ensure there's no conflict of interest. Your assessor will make initial contact with you to reflect on your booking form and the information provided, to confirm the numbers in terms of staff and number of service users, and that stage when we can confirm the scope of the assessment, which give you an indication of the time that we will invest in undertaking the assessment on your establishment, and of course the cost of that process. At this stage then you will be issued with a sales invoice, and payment has to be made to assessment services prior to the on-site activity taking place. Your assessor at this stage will agree the timeline in order to work with and support you towards the on-site activity date, and this will include the completion and submission of the self-assessment analysis. The self-assessment analysis provides the assessor with a story about your establishment and the systems, processes and outcomes that you gain in order to meet the different elements and criteria of the framework. And so it's there to provide us with a background to the organisation and an introduction to your systems and processes. You will be provided with an Excel template in order to populate the information required, so you're very clear on the different criteria that you will be assessed against. So you will provide short paragraph for each criteria indicating how you believe you meet the requirements and in some cases exceed the requirements of the framework. This document has to be submitted to your assessor at least 2 weeks prior to the agreed on-site activity date. Where possible, it will be provided through a secure cloud-based tool, which enables then the sharing of that self-assessment analysis document with your assessor. And you can also put different evidence documents that you'd like to present. For example, your business plan, training plan, any documents that you feel fit the requirements of the criteria. If you're a little bit have a phobia about technology, then it can be done through email, but we do err against just using paper documents because the self-assessment analysis document is shared initially with the assessor, and then the assessor will share that with yourselves to identify, a little bit about how they're going to delve into different aspects of the criteria to gain further understanding of systems, processes, and most importantly, the impact it's having on your business. So unfortunately, we do need to have some form of technology in order to facilitate the sharing of that document. Whilst you're possibly preparing, populating the self-assessment analysis, you'll be working alongside your assessor to plan the on-site activity. So you'll provide the assessor with a list of staff which clearly indicates their name, role within the organisation, and length of service. And they will select employees to be interviewed throughout the process. And this will include right from directors, owner managers, leaders managers, and those delivering the service, including carers, kitchen staff, laundry, cleaning staff. So anybody that's there to contribute to providing excellence in care in your establishment. In addition, we will interview a number of service users, if appropriate, I will hasten to add, family, friends, general visitors, and professionals. In the first instance, we would expect that you will be promoting to different stakeholders your intention to be assessed against the Excellence in Care framework, and we would invite family, friends, professionals to be part of that interview process. Alternatively, we may select different family, friends, visitors in order to ask a few brief questions in relation to the criteria of the framework. So, as a result of the planning process, the assessor will have a clear indication about your organisation, system, processes and outcomes, and be issued with the evidence self-assessment analysis prior to the assessment. And then also we'll have a schedule for the on-site activity, which clearly indicates who's going to be interviewed and at what time. So schedule will clearly indicate and include such activities as a tour of the premises, interviews with different stakeholders, and these, I do hasten to add, can be undertaken by face-to-face or telephone to save visitors, family, friends having to visit the establishment just for a 10-15 minute conversation. Interviews can also be undertaken on an individual basis or group. Forum of service users is often quite effective. A forum of visitors is also effective. So we have a cross-section of different people to be interviewed. And then also built into the time of the schedule is an opportunity to review any additional documentation that your assessor will have requested from you. At the end of the collection of evidence, your assessor will take half an hour in order to reflect on their findings against the criteria, and then prepare a brief feedback activity, verbal feedback activity, at the end of the on-site activity. This really confirms the outcome of the assessment, what's working well for you, what could be improved, and of course whether you have been successful or not in gaining accreditation against the Excellence in Care framework. If you are successful, then you will be issued with a report indicating areas of strength and areas to consider for improvement, and then expected to develop an action plan in order to facilitate continuous improvement throughout the forthcoming 12 months. If you have been unsuccessful and failed to meet all the requirements of the Excellence in Care framework, then again you will be issued with initial verbal feedback, which will provide you with a clear indication of the areas that you are meeting the requirements and those that need to be developed in preparation for a further formative assessment. A document in terms of a report will be developed for you, which will share the findings against each criteria, and those that are being met and those to be further developed. And again, it would be expected that an action plan would be developed, giving clear timelines in terms of action to be taken, and then the plan to undertake a further formative assessment. So development of an action plan I've mentioned on a couple of occasions. Irrespective of being successful or unsuccessful, as an organisation, it is expected that you would take that feedback and respond, act upon the feedback provided. So an action plan would be developed in order to clearly indicate areas for improvement over the forthcoming 12 months. It is recommended that this is shared within 3 months of the receipt of the report, so that the assessor has a document to reflect upon at a later stage. At 12 and 24 months, you would encounter a continuous improvement check. This is a telephone conversation, again with your assessor, which will reflect upon your action plan, what action you've taken as a result of the feedback that you gained, or other aspects of the service that you've identified as a result of evaluation monitoring that needed to be improved within the organisation. This process confirms that you are still committed to the philosophy of excellence in care and continue improving the provision of care within the establishment. And then every 3 years, the establishment would undertake a reaccreditation against the framework. So a very similar approach would be adopted as your initial assessment. However, we would once again be concentrating on the areas that you've improved over the last 3 years. How have you identified those improvements? What action and impact have you taken as a result? So that's a very quick look at the assessment process. Just to give you an overview of costs, and I'm not going to go into great detail because every establishment will be different in terms of number of employees. We do have a scoping model that is in place, which is based on the number of employees employed within the establishment. So as you can see there, the number of employees, if there's less than 50 involved in delivering the service to service users, that includes directors, senior leaders, managers, delivery staff, then it would be a total of 3 days. And that 3 days would include planning and documentation review, the on-site assessment, verbal feedback, the written report, and the annual continuous improvement check. Just to confirm, the annual continuous improvement check is undertaken by telephone and normally takes approximately 1 hour in order for the assessor to gain the information required. The daily cost for an assessment is £675 per day, plus expenses up to £100 per on-site day and VAT at the current rate. And as indicated, if you do require further information regarding costs, then please come back to assessment services and we'll be more than happy to look at your scoping and provide you with an indication of the time that it would take and the cost incurred as a result of undertaking that process. So I'm drawing to a close, but I think it's important to look at what the benefits are of working with the Excellence in Care framework. And initially, it demonstrates that leaders, managers, and delivery staff are constantly striving to improve the provision of the care, and continuous improvement is part of the ethos of the establishment. Now, as an assessor, we're looking for how, as leaders, managers of this establishment, you're fully embracing ideas, sharing views, opinions, in order to continuously improve the service that you're providing to the users. It does give you an opportunity to have an independent and objective, fresh set of eyes to explore your organisation and the activities of your team. You know, it is appreciated that CQC is in place, which is a mandated requirement. It is very much an inspection, whereas working with Excellence in Care is very much working in partnership with your assessor. Now, we're looking at how we can support you to maintain, sustain, and improve the provision of care within your establishment. So we work with you in order to prepare, plan, and undertake the on-site, and then give you meaningful value-added feedback in terms of how you could consider improvements to the provision of the care within your establishment. It provides you with the opportunity to gain feedback from a range of stakeholders. That includes service users, family, friends, general visitors, professionals, using different forms of feedback from surveys, interviews, forums. So it gives us an opportunity to give you an indication of what those users actually believe as the value of working with your establishment. It's a national and international benchmark which will drive the future of the framework and ensure that establishments are constantly being measured against the best. And probably most importantly, I think, you know, we're all striving for continuous improvement, but very often we do forget to take breath and really reflect on what, as an establishment, we're doing, and really recognise that we are one of the best care establishments in the world. You know, this will drive performance and provide you with that opportunity to reflect and hopefully then celebrate your achievements as an organisation. In the future, this framework is not going to stand still. Over the last 3 years, it has evolved, and as the initial organisations come up for their 3-year reaccreditation against the Excellence in Care framework, we're now developing Excellence in Care Plus, and this will demonstrate that an establishment responded to the feedback provided throughout the initial assessment and developed and implemented strategies and plans for improvement, and subsequently have measured the impact on the performance and the delivery of the service provided. So we'll be looking at actions taken as a result of the initial assessment and how this has been measured, and the impact which demonstrates that the organisation continually seeks to be the best in class. We are developing a website which will provide the opportunity to share excellent practice in the form of case studies, video testimonials and quotes, again with the aim of driving performance across the sector. Another new development is the use of client information, which is being migrated to a new CRM, which will facilitate better communications between you, the establishment, assessment services, and the assessor, which will then provide you with greater access and ability to share information with your assessor to keep them up to date with changes, improvements that you've made within the establishment. And in future, we're also looking at encouraging parallel assessments with other standards, because we do strongly believe that standards such as customer service excellence and leadership and management would add value to an establishment's performance. So, we appreciate that cost is always an issue, but would work with you in order to look at key aspects of customer service excellence or leadership and management. Some criteria may be appropriate. You may want to challenge yourself in order to identify what's working well, what you could improve. So we are introducing the opportunity to do parallel assessments with other standards. And again, we have a number of assessors that can assess against the different standards and frameworks. And the aim is that you would have the same assessor in order to ensure continuity of approach. And in some cases, if you are a large establishment, then we would put a team in place, which would be led by one assessor who would be responsible for collating the feedback from the team throughout the assessment process. So, an establishment embarking upon this journey will continually demonstrate areas of excellence and the desire to continuously improve its performance, and in a position to be able to recognise and celebrate its achievements. So that provides you with a very quick overview of the framework itself and the assessment process. For those that are interested, this is the contact information if you require further information. Possibly the best approach is initially email info@excellencesquared.com, and then you will be allocated an advisor stroke assessor to make contact with you to answer any questions that you may have. So I do encourage you to use the email in the first instance.